Symptoms of COVID-19 are fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Symptoms for the adenovirus include runny or stuffy nose, a mild cough, fatigue at times, sneezing, watery or red eyes, sore throat, headaches, which is a rare occurrence, and body aches and pains, as well as sensitivity to pain. There are three main forms of transmission of COVID-19. The first is droplets, which come from when an infected person breathes, coughs, or sneezes without a covering, and another person is within a close proximity and breathes in these particles. Aerosols are similar, but typically in a closed, confined space, stay in the air, and a person is not infected would breathe them in from another person that is infected. Fomites are when a person that is infected coughs, sneezes, or touches a surface, and a person not infected touches that surface. Adenovirus can be spread similarly to COVID-19, but it additionally has the fecal-oral route, which is when fecal matter from an infected person touches a non-infected person, or the direct inoculation of conjunctivitis by tonometer or fingers, which is essentially when someone that has the illness on their eyes touches their eyes and gets another person uninfected sick. Being that COVID-19 is so recent, treatment is very few and very little. There are some antibody treatments and other therapies that are being experimented on, but their success rates are unknown and currently still being investigated. Adenovirus has no cure, but pain relievers as well as cough syrups have been common treatments to relieve some of the pain associated with it. Additionally, eye drops might be used by people infected to try to relieve their watery eyes that come as a result at times. For COVID-19, there are several high-risk groups. The main will be people with chronic lung disease or asthma, cancer survivors, diabetics, people with obesity, people with serious heart condition, immunocompromised people, including people with AIDS, and people that are aged 65 years and above. Unlike COVID-19, children under 6 have seen an increasingly large amount of trouble with adenovirus, as well as people with weak immune systems, people who frequently smoke, and people that are under high stress or suffer from anxiety. COVID-19 is a spherical or envelope particle containing single-stranded RNA associated with nucleoprotein with a capsid comprised of matrix protein. The envelope bears club-shaped glycoprotein projections. Some coronaviruses also contain a hemagglutinin esterase protein. An icosahedral protein shell surrounding a protein core that contains the linear double-stranded DNA genome. There are 12 vertices of icosahedron and are occupied by units called penton, each of which has a slender projection called a fiber.